everyone to another episode of ELPA podcast. We call it Small Steps, Big Changes series, building a healthier liver through everyday habits with ELPA, where we are addressing the importance of daily healthy habits, healthy lifestyle to empower our community with knowledge, motivation, and essentially to support each other along the way. Today, it's my great honor and pleasure to welcome to Brussels Dr. Professor Manuel Romero Gomez. How are you?
Fine, thank you for inviting me. It's always a pleasure to visit Brussels, to visit ELPA, and to participate in this type of fantastic activities.
Thank you very much for taking your time of your busy schedule, because we know you are super busy. I will just name a few titles that you hold. So, Professor Dr. Manuel Romero Gomez is coming from Sevilla, Spain, and you are a full professor of medicine at the University of Sevilla. Then the head of the unit of digestive diseases at Virgen del Rocío University Hospital. You are also head of translational research on GI, liver and inflammatory diseases at Institute of Biomedicine in Sevilla. And last but not least, you are also a president of Spanish Association for Study of the Liver.
Correct.
A lot of responsibilities and roles, positions. How are you handling all of that? Or should I ask exactly how your day look like?
I'm working 200% every day, and when I'm losing some of them, perhaps we can reduce 180%, but at the end of the day, I'm working very, very hard for a long time. I don't know exactly. For sure, I'm very happy because I'm doing exactly the things that I love to do. This is the key point, but doing a lot.
Because I know that you are also attending many important European international congresses, so you're really on the top level when it comes to research and latest data.
Yeah, right? At the end of the day, you love to do the best for the patient. You are learning a lot in the patient office, patient teaching us, and we are taking the idea. We need to demonstrate that. We need to prepare the experiment in the preclinical in animal models or even in clinical trials. And at the end of the day, we need to disseminate. If we are not telling people that we are learning how relevant is lifestyle intervention for the liver and for the global health, we cannot we cannot reach the top of our activity, no? And we need to go ahead with everything. A lot of activities, a lot of aspects that is mandatory, because it's the final report, is the final work, is the small sand that we can put on the development of the medicine.
Today we will be touching on the importance of healthy lifestyles for patients. But let's maybe step back and say to our audience what liver is, what it does. Is it important or it's not important? Why is it important? Let's firstly give the audience the general knowledge about this organ.
The liver is the biggest organ in our body, and it's a factory. It's able to produce everything we need and to remove everything we don't need. It's many action to help in the digestion, to help in the equilibrate the metabolism of glucose, lipids, and proteins. And at the end of the day, is the enzyme we need in our body to go ahead. I would like to recommend you to read an Oda to the Liver from Pablo Neruda, a famous poet from Chile. He wrote a fantastic poem about the liver and explain all the activities, all the good things that the liver is doing every day, and comparing with people working humble, doing their best all time in a silent manner. It's not the heart, it's not the brain, it's the liver, but it's the key organ in the body. It's freely available in internet, and you can read Ode to the Liver by Pablo Neruda.
You actually mentioned this several times, so I will try to make sure that our team adds a link, or that audience really can find it. It's also true that the liver can or has this capability of self-regeneration. Nor can you explain?
Yeah,
this a little bit more?
it's fascinating because the liver, as is the engine of the body, it receives many injuries, damage, and is trying to do their best. But it's curious that the regenerative property of the liver was very impressive, because if you, for example, a patient undergoing an hepatectomy and you reduce the size of the liver by 50% or two-thirds, in 6 to 9, 1 year, you can see how the liver replaced completely the space where the liver was, and you can see that the final size of the liver is the same, but it's not happening in the kidney or in any other organs. It's quite interesting. This gives us a very good opportunity to think that everything is happening in the liver is going and backing, and you can progress and regress. And if you need to remove a part of the liver, you can be confident that the liver is replacing over the time to reach the same size as at the beginning.
But why do you think liver is the only organ that has this capability?
It's a very important question. It's not very easy, because we need to put together the biology with the biomedicine, the physics, and the engineering, and it's very complex to know how the liver could expand, but just exactly to the site he could expand and could replace perfectly every function, because they are the same cell producing the number of cells the liver needs to have the perfect parenchyma like before. It's curious, but it's one of the most fascinating mechanisms that you can find in the physiology of the human physiology.
So how indeed can healthy lifestyle help liver with this function, and also with also other functions of liver?
It's in the last 15-20 years, we realized that the lifestyle is a key aspect in the liver. For sure, we know that the genes are very important. When we were born, we have a genetic background, and this gene could promote or avoid any progression of liver diseases, etc. But after this genetic background, the lifestyle is the key point to promote a healthy liver. No? Lifestyle. When we are talking about lifestyle, we need to think all time in diet, physical activity, and avoiding any toxic for the liver, mainly alcohol and other, but mainly alcohol. If you are doing a Mediterranean diet, if you are doing standard physical activity, aerobic, moderate physical activity, and you are avoiding drinking alcohol, you can improve the health of your liver, but in 3 different manners. The first, you can prevent the development of liver diseases. If your genetic background was in the fate of developing liver diseases, if you are doing this lifestyle, if you are implementing this lifestyle in your life, you can avoid the development of the disease. But if you are suffering the disease and you modify your lifestyle, you can stop and to promote the appearance. But if you develop an advanced liver disease and you are in the end stage of liver disease, if you modify your lifestyle, you can promote regression of the liver disease, improve portal hypertension, improve, for example, the risk of developing hepatic encephalopathy. And it's fascinating how over the time liver disease, from the healthy liver to the damaged the injury in the liver or advanced liver disease, putting a lifestyle, we can promote we can prevent regress or avoid complication in the different stages of the disease.
We will indeed dive deeper in these disease stages and importance of a healthy lifestyle. But let's maybe for the start explain to our audience what is MASLD, what is MASH, is this something, what is this fancy abbreviation in a very easy to understand language? How are you describing this to your patients?
Yes, because the audience is not aware of that, but perhaps they are not interested, but we has been in the last 5 years many debate how can we need to name, if we need to change the nomenclature. At the end of the day, we are using MASLD, MASH, that is metabolic dysfunction associated steatotic liver disease, or metabolic dysfunction associated steatohepatitis. The idea is a patient that is suffering from fat in the liver, and this fat in the liver is associated with the presence of any metabolic disorder. A patient with obesity and fat in the liver is suffering from MASLD. A patient with diabetes and fat in the liver is suffering from MASLD. When this fat in the liver is shared, the liver with inflammation, we can start talking about steatohepatitis. The first feature is the rise of transaminase, that many more than half of the patients with MASLD show normal levels of transaminase. Transaminase are the enzyme that we have in the hepatocyte, and when rise means liver diseases, but we know right now that many liver diseases could show normal levels of transaminase. In this case, when a patient is with a very high levels of transaminase and with fat in the liver, we can suspect the patient is suffering from steatohepatitis. This is the key point. You need to think that how can we demonstrate fat in the liver? A patient shows fat in the liver after a liver ultrasound, for example. You can see the liver white in comparison with the kidney, for example. But also you can use the VCT, the vibration controlled transient elastography, the famous FibroScan, give us two parameters. One of them are the kilopascals to demonstrate the stiffness and to calculate fibrosis, but also the controlled attenuated parameter is the CAP, and the CAP give us information about the fat infiltration. When higher than 2.58 to 62 decibelius per meter could invite us to think that the patient is suffering from steatosis. Also, some non-invasive blood tests could allow us to suspect steatosis, but I prefer to use one of these imaging biomarkers to stratify the patient as suffering from steatosis, and second one to look for the metabolic disorder, and we can have the final diagnosis.
Are there any symptoms that our listeners can sense on their own to maybe go and check the liver, or
the liver diseases in general, they are quite silent. We cannot detect any liver disease due to pain. The liver is not paining usually, and when you detect any sign of any symptoms, is because the liver is very bad and it's the end stage liver disease. Therefore, we need to prevent. We need to prevent and to promote early detection. Early detection, because to detect liver diseases is very easy, very standard routine blood test that any family doctor or any in the company doctor, you can have a blood test. It could give you enough information to divide the population into groups with and without liver disease. For example, in patients with drinking more alcohol that they need and they should, or patient with a metabolic dysfunction of any type, lipid or glucose or arterial hypertension or obesity. In this patient, it's very important to detect a liver disease using blood tests. Mainly FIB-4 is a fantastic tool, allow us to calculate if the patient is suffering or not from MASLD and fibrosis. If the patient is not showing fibrosis, we can keep quiet. If the patient is showing fibrosis, we need to work very hard. And the first should be to restart lifestyle to modify the natural history of the disease.
It could be also worth saying that it's actually 25% prevalence of these diseases, right, that we are fighting
Correct.
here in Europe?
Correct. Yes, just last week in the Spanish liver meeting in Madrid, people from Santander, Professor Javier Crespo, showed that the Cantabria cohort is more than 40,000 people invited aleatorily by a randomization of the census, and were invited to participate just in a checkup of the health, doing some blood tests, some ultrasonography, fiber scan, etc. And in these 40,000 people, 29%, means 30%, showed steatotic liver disease.
So it's really
Close
alarming.
to a third of the Spanish population in the north of Spain. I think it's a major health problem in Spain at this time.
But for a long time, the alcohol was seen as like the main risk factor for liver diseases, right?
Yes, it's true. In Spain, in the last survey of alcohol consumption, approximately 9% of the population drink alcohol in a pathologic level or in a toxic level. That means we need to add to the metabolic disorders the alcohol consumption, and we can surpass this a third of the population, 35% of the population in Spain, in Europe, suffering from steatotic liver disease.
But now let's go back to healthy lifestyle. So let's say unhealthy lifestyle. How can unhealthy lifestyle affect our liver? Or why we should keep healthy lifestyle to improve the condition of.
It's curious. It's curious, for example, that it's very common that we are trying to advise about food, nutrients, and sometimes, for example, it's very common to listen that coffee could be beneficial for the liver. It's true. Or nuts could be beneficial for the liver. But the key point is to have a dietary pattern that could be the best ally for the liver. Is a Mediterranean diet is very important. But for example, when you analyze what is happening with the olive oil, I love olive oil. I think olive oil could be a drug because it's highly beneficial, but it's especially a very good nutrient when inside the Mediterranean diet. This is the key point, is how can we educate the population to be as much adherent as possible to the Mediterranean diet, to avoid fast food, to avoid trans, to avoid ultra-processed food, to avoid sugar sweetened beverage, or to avoid saturated fat. This is the key point. How can we eliminate the enemies of the liver from our diet, and how can we adopt a Mediterranean pattern that could promote, because all this, for example, coffee, nuts, olive oil without alcohol, could be very precise mechanism of action to promote liver health. And it's sometimes when we are talking about advice, what is the best lifestyle? Please do physical activity. Please do Mediterranean diet. Sometimes this is just an advice, okay, it's a mantra. People, they are talking all time about that, but it's not. You can see over the time that doing that, you can reach better results even than when you are taking pills or you are addressing these diseases from a different manner.
Because we indeed have the scientific guidelines that are focusing very clearly also on the importance of healthy lifestyle, right?
For sure. This is for example, this is the diet. And if we move to the exercise, it's the same. Doing exercise, but sometimes, what type of exercise? No, you don't need to run a marathon. But you can, if you avoid sedentarism, you are helping to improve your liver by many mechanisms. You are promoting myokines, you can promoting the synthesis of hepatokines, and you can better balance the adipokines. And at the end, the inflammatory environment in the liver will change completely from a red to a green liver, no? And that means it's very important. And my main aim today in this podcast is to convince people that doing that is not just an option, or just to say, okay, I can go to the north or to the south. No. you need to be absolutely confident that you are suffering from any liver disease. If you are at risk of developing liver disease, doing that, you are treating your liver disease and you are avoiding a big problem and you are saving a lot of money for you and also for the society.
What about for individuals? Because scientific guidelines also mentioned weight reduction between 7 to 10%, right? So, as people, we tend to stick to percentages and so on. But how do you communicate with patients that are stuck with weight loss? So I guess still continue with healthy lifestyle because probably there is some positive impact.
Yes,
right?
I'm trying to divide in two parts the message. One of them is if you are able to lose 10% of your body weight, you can cure your liver disease, okay? But you don't need to lose 10% of your body weight to achieve this goal, okay? If you are doing that and you are losing because you are starting an hypocaloric diet, hypocaloric Mediterranean diet, doing a lot of physical activity and you are losing 10 kilos, wonderful, fantastic. But if you can't, no problem at all. Because many patients, for example, improving the fitness and doing physical activity, more exercise, they can improve the liver without a dramatic change in the body weight. Indeed, in many trials in which we are doing both the diet and physical activity, you can see how more than half of patients that improve fibrosis, that at the end of the day is major concern, this patient could not lose more than 10% of body weight, even less than 5%. But if you are replacing fat to muscle, if you increase muscle mass doing physical activity, you are not losing in the overall the body weight, but you are changing your body composition in a fantastic manner because losing fat and increasing muscle mass is the perfect combination to improve the liver.
And for the audience, we will also be addressing this specific topic in another session when we will be focusing on physical activity. So I'm just inviting everyone to also check that episode.
Wonderful.
But let's go a little bit more practical to your practice and when you have this conversation with patients. Any tips, tricks? How do you motivate patients to start maybe at the beginning or maybe at the phase where they are trying, but they don't see results?
I'm trying to convince from the beginning, and the first time I meet him, then just if I realize the patient is suffering from metabolic disorder and steatotic liver disease, I'm trying to convince them that they can do many things. I'm not very strict. I'm not planning to reduce body weight in a very short period of time, of increase fitness in 3 months. We need to think that it's for all the rest of our life. We need to be quiet. We need to work slowly. A small step are very highly beneficial for the liver. If you are losing 2%, 3% of the body weight, you are changing completely the trajectory, and you need to be absolutely confident you are going to a completely different place in comparison with the original. And this is my strategy. For sure, I not judge. I not try to explain people why they are fat or they are develop diabetes. The key point is now we have a challenge that is a very nice opportunity to promote your health. I'm trying to invite them to be part of this program. In the case we cannot be successful, in this case we need to explain from the beginning that we could have more tools to be implemented in the case they are needed. For example, drugs or surgery or any other tool that we can have in our hand to improve the metabolic disorder.
You mentioned at the beginning that healthy lifestyle is a puzzle of different things. So we mentioned nutrition, physical activity, and then also reduction of toxic
alcohol
substance intake. Do you recommend to attack all three at once, or should somebody maybe focus more on nutrition while somebody should focus more on just being less in a sitting position and just start to slowly walking? How do you manage this?
Yes, I'm trying to develop a program slowly, and at the beginning, the first is to avoid the enemies of the liver, including sedentarism. I invite them, please don't eat any ultra-processed food, any saturated fat or sugar sweetened beverage, and for sure avoid sedentarism. I don't know if you are doing physical activity just 1 or 2 or 3 times per week, but please avoid sedentarism. This is the key point. For sure, many patients, they are older with many comorbidities, with very, very low mobility possibilities, and I try to adapt. We know, for example, that the physical activity, it could be fantastic to develop aerobic, moderate aerobic activity, but if not, you can do an exercise resistance and you can go ahead in the same manner. The key point is to change the trajectory. The idea is you are going directly straight on to the complication, to the progression of the disease, and if you are doing anything, you can change the trajectory. For sure, if you are doing in the opposite, you can move 180 degrees back, and you can be far from the complication. But the key point is to modify this trajectory, and I'm trying to be absolutely confident, because patients, they are not suffering metabolic disorder due to a personal decision. No, it's a very complex disease. It's a very complex with mental influence. Now, for example, the things that we are using to treat, like semaglutide, for example, obesity, we know that had a very, very direct effect in the brain or in the pancreas or in the stomach. And we need to share with the patient that it's a very complex, that is not just a decision by the patient, and I'm very funny to be diabetic. No. It's a metabolic disorder with involving many organs, and we need to be part of a multidisciplinary team able to address each of these different points that the patient need to be that the disease need to be addressed.
Can you explain a little bit more the term multidisciplinary team?
Yes. The key point is when you are analyzing a patient, you are doing a clinical record, you detect that the patient will have some mental disorder, anxiety, or the patient could be have a very bad education, because during the childhood they was receiving many that fatty child could be the best, but for sure, if you explain that the amount of food that they are putting in the plate, or how many times they are eating, and the idea is we need a psychologist to help us to address all psychological biomarker, psychological aspect of the disease. We need an expert nutritionist able to teach the patient how they need to eat the different food, the correct food. And for sure, when addressing physical activity, it's very important to have a sport medicine specialist able to, because the first barrier is, I'm sorry, I cannot do anything you are recommending me, but okay, I'm looking for any other option. See, always we can find any other. And at least the hepatologist, the sport medicine, the nutritionist, and the psychologist, I think is the minimum multidisciplinary team, the minimum team, especially that we need in the team, able to address this disease in a multi specialty approach.
Are these multidisciplinary teams already out there working perfectly, or are we still missing some puzzles there?
At this time, I think the majority of the hospital, they are doing that just under clinical trial, under research, in a special condition, but not in clinical practice. It's not routine clinical practice. In Spain, for example, we can have psychologists available to do that, and for I contract psychologists participating in my team to go ahead with the clinical trials and the projects. But if we are including 100% of the patient in the clinical trial and the project, perhaps we can move all of them on this clinical pathway. But I think it's mandatory. In our first intervention, we reached 10% of succeed. In the last, we were succeed in 36%. We increased by 3 times, and I think we improved the multidisciplinary team working with these patients.
That's very good to hear. So patients are really in the center of this team, really putting forward the unmet needs and also holistic approaches, as you just described. Maybe let's touch on, so for patients that are listening to us, how do you measure the improvement? How do you measure if they are more physically active or if they are eating healthier? Is there some kind of a scale? It's just more like a conversation?
In Spain, it's a multisystemic disease affecting different organs with different metabolic disorder. We have the liver. And for us, it's very important to monitoring the liver, how the liver is going. We can use the blood test, we can use fibroscan, liver ultrasound, elastography, and PDFF. For sure, when you are planning to do an intervention, you are planning to modify lifestyle, it's very important to give confident information to the patient. And we need to use strong tools able to give us information about how the liver disease is going. And for me, it's very important. If fortunately I'm using a lot magnetoscan elastography to analyze how is shifting the disease and if improving or not. And it's a very strong message for the patient. If I'm doing my best, I'm losing weight, I'm doing physical activity, my kilopascal in the liver is a half, I will be the happiest guy around the world. And this is a key point. For me, it's very important that together with the multidisciplinary team, we need to have the channel of the different tools we need to perfectly monitoring the disease, and we can advise our patient, you are doing very well. And indeed, it's very common. It's very common that you can find patients that arrive to the outpatient office suffering with an advanced liver disease, and you have this conversation with him, starting doing very well, and 1 year later, advanced fibrosis disappeared from the liver, and everything was okay, and the patient was in a completely different position.
So you said 1 year. I think this is also important to give the perspective of a timeline, right? So I don't know, I think the obvious question is, okay, if I start today, when I can see the results, or what kind of results I can see, maybe in 6 months, maybe in 1 year. How do you answer these questions?
I think 6 months is okay. We need to take care more frequently at the beginning. But for example, in the first 3 months, we need to check what is happening in the patient and to analyze at 6 months if any relevant change is happening. After that, we can monitoring every 6 months or every 1 year, depending on the presence of advanced fibrosis at the beginning or not. But I think at the beginning is very important. Indeed, when we are doing any intervention in a clinical trial or any project, etc., we are taking care of the patient every 4 weeks, every month, for the first 3 months. And after that, to 3 to 6 months, and after 6 months, every 6 months. But I think it's quite productive for the patient and for the doctor, because it's very well balanced.
Do you have maybe for our audience some kind of a good practice, or not good practice, but like a good example, maybe some of your patients did really great that you can share with the audience to motivate them?
We have a very famous patient in Spain that was Ministry of Health in Spain. Last year, I received an invitation from British Medical Journal to write a paper about muscle, and was focusing on how muscle is an opportunity, no? How diet is the cause and the solution of the disease, how sedentarism is the cause, but physical activity and exercise could be the solution of the disease, how stopping alcohol drinking could be the solution of the disease. And in this scenario of oxymorons, no, with the same thing could be beneficial or harmful, the editorial asked me, why are not inviting you a patient to be an author? And as this patient is a full professor of medicine and is, has a very important curriculum in his life, he accepted, and now he's public, and he's the happiest guy around the world. Because 10 years ago, he underwent surgery. The surgeon made the decision to take a liver biopsy, and the report was cirrhosis. We were absolutely astonished. Oh, what is happening? And we implement a change in lifestyle. At this time, we have now a lot of clinical trials, and I started doing more physical activity, doing Mediterranean diet, and avoiding any alcohol. 10 years later, fibrous scan is under 5. He developed esophageal varices and suffering from Barrett esophagus. We need to use radiofrequency. Was a very complex procedure in the endoscopy, and in spite of that, we were successful doing that, and now the esophageal varices disappear. It's unbelievable how, because I think 10 years ago, 20 years ago, we were thinking that cirrhosis, the final stage of liver disease, has no return and you cannot go back. But no, this is a plasticity in this disease in which you can move forward and you can regress backward in a very fantastic manner. And this case was just an example that lifestyle intervention could modify completely the natural history of the disease. And we need to include in our lifestyle, in our mind, that we can. It's a tool, it's a challenge, an opportunity that we have in our hand. The key point is to educate to people to be absolutely confident that it's not just an advice, it's a therapy.
When it comes to this deeper level of education, right? So going really deep and giving a practical examples, do you think we are missing some sort of supporting groups, communities? Of course, ELPA as the umbrella association, we are really trying to include also our members on a national level. But maybe from your perspective, what are we missing? Can we, as the community, be better? How to better support patients in this journey?
I think expert patient is a very good figure and could help many people. And for sure, we need to engage all the society. We need to engage the parents, the child, for sure, the teachers, the university, politician, medical doctor, nurse, all people working healthcare providers, because we need to everyone to promote this change, because doing as we have been doing in the last 30 years, we are moving fast to a pandemic able to destroy the health budget. The WHO was thinking that approximately 70% of the overall budget, the budget for the health, could be dedicated to metabolic disorders in 2050. That means we need to modify that. How can we do that? With education. We need to educate everyone. Who should educate? Everyone. For sure. Patient Association is a fantastic organization able to reach easier to the patient. For sure, the health professional, we need to promote this education in every opportunity we can have, in the outpatient office, in the inpatient, or in the general society. And I think it's very important to engage. We are doing very important things. It's like the tobacco law. we regulate that we cannot smoke in many places. Fortunately, we need to move on this way. And at the end of the day, if we change the education of the population, we can be much healthy society, and for sure we can invest much better our budget.
So I'm just going back to, because you mentioned we have to educate. So one thing I think is giving the information. So, we as society, we have informations, but then we have the second step, okay, let's implement them on a daily basis, right? So maybe, because now we are living in a digital era, AI era, let's maybe touch on that. I would really like to hear your opinion. How can these softwares, technical support patients? Do you think they are already playing some sort of a role, but maybe negative, positive things. What is your opinion?
It's quite complex to address, but from my point of view, I would like to dream with a law that could regulate perfectly what should be the position of the society against this type of diseases. And we need to regulate the looking for a healthy diet. It's very important to regulate. We need to tax for the food that they are harmful, and we need to pay from the government for the drugs, for the food they are beneficial. It not could be cheaper to drink a Coke in comparison with a bottle of water, for example, and we need to do that. If we are planning, how can we educate without this type of regulation? I'm not sure. Sometimes I'm feeling all the digital media, the possibility to connect by social media with the young people and the medium-aged people. It could be, but the personal information, when you are feeling you are being part of the problem, I think the information is a little more fluent, and the people, they are more motivated and interested. But I think all time we need to keep all tools that we can have in our hand. If we are using digital, paper, or we are trying to do our best when taking care face to face with the patient. But I think we need to keep all.
Specifically also because of the fact that we are seeing younger populations suffering from obesity, diabetes, which are like risk factors for liver diseases. So, and this generation is maybe more inclined to use digital tools. So we have to also think about this aspect, the generation way of communication, right?
For sure, I completely agree. Indeed, the strategy of many governments focus on young people, on the childhood, and I think it's very important to address that, because this is the part of the population that they are at much higher risk, and for sure doing any intervention in this group, it could be highly beneficial. That means for sure we need to use digital media, social media, and to share with them the true, not fake news, true news, but it could be an opportunity. For example, in Spain, fighting against alcohol and the damage of alcohol in the society, we are starting with the younger people. Because for sure it's mandatory that we cannot allow the young people under 18 years to drink alcohol, but also because we are taking care of the future of our society.
Moving towards the liver cancer and healthy lifestyle, how this goes together, is still relevant in the same amount or maybe less? Let's open this discussion.
Liver cancer, as you know, is one more step in the liver disease progression. That means everything we are doing to prevent for early diagnosis or intervention, we can avoid liver cancer. And this is the key point. We need to take care of our liver, because doing that, we can prevent liver cancer. And curiously, the lifestyle could modify or could prevent liver diseases, could modify or regress early liver disease, but also could be highly beneficial in end-stage liver disease, including patients with liver cancer. And when possible, the patient should modify lifestyle, because this increase the performance in the fitness in patients with advanced liver disease with liver cancer could improve the prognosis. It's a key point. We need to fight against sarcopenia that could be a major driver in the progression of the liver cancer, and for sure doing physical activity could avoid many complications. Last week we share data on how physical activity after tips placement decrease the risk of hepatic encephalopathy, and if we can prevent all this decompensation, we can improve the prognosis of liver cancer. At the end of the day, if lifestyle is so relevant over all the natural history of the disease, in the period of the liver cancer is a little more relevant than in any other.
Any final comments, suggestions, statement to our audience in the scope of the role of healthy lifestyle in liver diseases?
I think I figured out in the last few years that changing lifestyle is not just an advice, it's a polypill, it's a multi-pill. We can use like several drugs that we can take every day, and this polypill is able to address the majority of the pathophysiological mechanisms that they are altered, and doing that we can improve the pathophysiology, we can promote regression, and we can avoid the progression of the disease. That means, from my point of view, is we have in our hand a most powerful tool that we can anticipate a few years ago.
Thank you very much for your time, Professor Dr. Manuel Romero Gomez from Spain. As always, you are a dear friend to ELPA. We are really grateful that you collaborate with us also in these occasions. I believe this session was really informative, very important, and I would just say thank you very much for your time. And to all of our listeners, stay tuned for more episodes. Thank you and goodbye.
Thank you very much. A great pleasure to be here.